welcome to the Life in Journal podcast. My name is Nick.
I'm Ian.
Hey, look at that. Ian actually said his name like normal for once.
I did?
Yeah.
What the fuck's wrong with me?
You weren't like, my name is Sloppy Bob. I'm here to sell you like used cars.
Well, I figured the topic of this that we're about to discuss is on a slightly more serious side. So
slightly.
Yeah, I'll take it seriously for a few minutes anyway.
Just for a couple seconds.
Yeah. Well, it's one of those situations where it's better to laugh about this shit than not.
First off, I want to kind of preface this whole thing by saying that, first off, Ian and I both work. So we're going to talk about COVID or coronavirus, whatever you want to call it. Mm-hmm. We both work in a rather big hospital in the emergency department. And of course, everything we say is in no way connected to our employer.
Yeah.
All these
disclaimer.
Yes, everything said is our own thoughts.
Yes.
And neither one of us are medical professionals, even though, I'm in nursing school and I will be a nurse hopefully this time next year if school ever gets back in.
Right.
But I just feel like there's a lot of stuff that's being said in the media, in social media, that is, I think, misleading. And at least, I don't know about you, but I've been trying to, we get daily multiple emails a day from not only the hospital but also the CDC. So I kind of feel like we know some of the stuff that's kind of going on.
Well, you do because you probably read your emails.
I
do read my emails. I just don't read them as intently as others.
Well, yeah, I will admit that I don't read all of them, but I read a good share of them. But I did have to create a subfolder that I'd start moving them into because it's like.
Did you just call it Rona? The Rona?
the Rona. It's there's some days we'll get 5 emails.
Oh, I would say we're getting a minimum of 5 a day.
Hey, but I do appreciate them kind of keeping us up to date. Obviously, we work in the emergency department, so we kind of see a lot of the stuff coming in. Mm. Yeah, I just wanted to say up front that this is in no way reflective of our employer. I just wanted to get that out there. I don't want anyone to come back at us.
Right. Because called into HR on Monday.
Because if you go on my Facebook page, it says where I work. So it's not.
Right.
I really don't care. But
I don't care either. Not going to say it on the air, but I don't care either.
So I got this I don't know. I'll kind of go through this. There's a timeline. It's somewhat lengthy, but I'll kind of keep it short enough to where it doesn't take up too much time.
Nick Short? Because Nick Short isn't really short.
It's it's 2 pages.
Oh. All right. Well, I'll try not to interrupt
too much. And I kind of focused obviously on China because it's kind of
where it started.
That's where it started. Yeah. First off, I want to say that it's kind of strange that a lot of this stuff comes out of China. This and SARS and what was it?
All of our products that we use.
No, bird flu. I'm talking pandemics.
Well,
or miniature pandemics.
It's population. That's why.
So I kind of focused a lot on China, and then obviously the U.S. because that's where we are, and Italy.
We are? I'm sorry, I did say I'd keep my interruptions to a minimum.
I'm looking for something to stab you in the eye with.
You're always looking for. I'm surprised you don't have a knife just sitting here.
So I looked at China, I looked at the U.S. and Italy also because Italy, as far as the curve and everything goes, we at one point we were kind of tracking along the same line, about 11 to 14 days behind them. So I kind of looked at their numbers also. Mm-hmm. But if you go back to November of last year, that's kind of where the first COVID case was reported to the Chinese officials. At least that's what they said, at least. See, and that's kind of a lot of things, everything that kind of comes out of China. And I think that's where a lot of people's frustration is that they were so secretive up front.
Right.
And for a long time, they kind of denied everything that was going on. And I think it kind of made the situation worse, at least in Asia and Eastern Europe, for the most part. Mm-hmm. Right. Would you agree to that?
Sure.
So mid-November, the first case comes out. December 8th through 18th, there were another 7 cases in China. And then really the beginning of January 7th, the U.S. issues a travel warning to everyone traveling to that part of China, which is, I think, was an appropriate step.
Yeah.
I will probably veer off from Ian's opinion a little bit along these, because I will agree with some of the more questionable things that the president has done, and obviously not other ones.
To be honest with you, I was I kind of felt that at one point, he was doing everything he was supposed to be doing. The problem is that didn't last very long, and he's kind of gone off the rails.
I have a Trump timeline also.
Okay, because for a brief moment, I was like, all right, he's doing what he's supposed to be doing. I'm on board with this. Mm-hmm.
So
didn't last long.
January 8th is when the scientists in China officially announced that they discovered a new strand of coronavirus. So there's hundreds of different strands of coronavirus. And COVID actually stands for coronavirus 19, is what COVID-19 stands for.
And because it was discovered in 2019. Yep.
So SARS is another form of coronavirus.
Okay.
And so this strand of coronavirus is actually closer linked to a strand that they found in bats. So that's where the whole thing, someone eating a bat soup.
Right.
Which isn't, we don't know how it started.
Right. Well, at some point it had to mutate to come to humans.
And from what I was reading the last couple of days, it's actually mutated since it's...
Probably, because it's gone through enough humans to mutate.
So January 8th is also the first case that there was a first reported case outside of China. So that was in South Korea. Mm-hmm. The next day, January 9th, is the first death in China that was reported. It was a 59-year-old that had gone to this specific market in Wuhan, I think is the city. The city is, I want to say it's several million people are in the city. So it's one of the larger cities in China.
Right.
So I think the numbers, if you look at, I want to say the last numbers I saw, there was like 80,000 cases in China, reported cases or verified cases. And a lot of those were in that province, I think, because it kind of...
A lot like we're dealing with New York.
Exactly. So yeah, on January 18th, so 10 days later or 9 days later, China confirms there was an additional 62 cases. So it starts growing, but it's funny, it kind of takes a while before it really blows up. So you're talking like mid-November now to almost late January. So you're talking almost 2 months there. And the two or 3 days later, so January 21st, it was the case number was already the cases were up to 312. And it was also at that time was the first time, because the first like 2 months of it, they didn't know how it was transmitted. Mm-hmm. So it was the January 21st is when scientists in China came out and verified that it could be transmitted human to human.
Right.
And also at that same time, it was the MCR, which is the Center for Global Infectious Disease and Analysis at Imperial College in London, suggested that the Chinese government was underreporting the true numbers, and they estimated it to be closer to 1,700 people at that time, which is a huge gap. And like I said before, that's where a lot of people's frustration, I think, comes from is the China tried to hide it for too long that something was going on, and I believe at that time they had already like completely shut down that area of China. Mm-hmm. Restricted access in and out, but the U.S. was still bringing people out of the area. So, and that's kind of where like the how it traveled to the U.S. because it was the same day, January 21st, is the first day that the U.S. reported that there was a case in Washington. So from that time in January, the 26th, it took the 26th to us to get our third, fourth, and fifth case, and then. On the 27th, the dean of the University of Hong Kong Medical School, which is one of the foremost experts in SARS, which is a similar strand to what this is, estimated that at that time, of course, he said this is his estimation, that there were between 50,000 and 100,000 cases in China. Mm-hmm. So at that time, China was only admitting to a fraction of that number, which even... So this is what March 21st, and they're still, I want to say, 80,000 cases. So they're nowhere even close to 100,000 top end of what his estimation was.
At least as they're reporting it.
True. Because actually at this point, and now at the end of March, cases have actually kind of started going down in China. But it wasn't until January 27th that the U.S. revised their travel advisory and actually finally issued a level 3 warning and advised people to avoid traveling to China.
Right.
So I think that's another kind of issue is, yes, they started issuing these travel warnings earlier, but I think they were kind of late to the game with restricting travel.
Mm-hmm.
So on January 31st, the UK, Russia, Sweden, and Spain all report their first cases. So it took longer to get to those places than it did here in the U.S. And it was January 31st was when Italy finally declared a state of emergency, and they had only had a small handful of cases at that point.
All right.
It was also the same day the U.S. declared a public health emergency and closed its borders to all foreign nationals, which the president took a lot of heat for when he took that action, because people were saying, "Oh, it's based on racism and things like that." And I think it was the correct move and probably should have been done sooner.
Yeah.
And that was just restricting access incoming from flights, because it was just this past week that they closed the border to Mexico and Canada.
Mm-hmm.
So they weren't keeping out people; they were just limiting access at that point. So on February 26th, the number in all of Europe, case-wise, was about 31, and at that same time in Wuhan, China, was 554.
Mm-hmm.
So their numbers, and like I said, that was kind of the strange thing about it was it took so long to kind of catch up. And obviously, we're kind of going through the same thing here in the U.S., because I want to say as of right now, we're just under 25,000 cases in the U.S.
Yeah, I keep seeing different numbers, so I wouldn't even begin to speculate.
And as of about a week ago, I want to say the number was about 2,200.
Mm-hmm. The last number I saw, and this would have been last week, was under 10. 10,000 is like 7,000 maybe.
As of
last week.
As of 6:52 p.m. So that was, what time is it now?
I don't know.
So that's about an hour ago. The U.S. had
45 minutes.
Yeah, 23,940 confirmed cases.
Okay.
Which is an increase of a little over 4,000 today.
And the vast majority of those are in New York City.
I wouldn't say a vast majority of them. I would say
a high percentage of them.
Almost half.
Yeah, that's
so we
vast majority.
We got 24,000 cases. 10,000 of them are in New York.
Right. That says a lot, because we're talking about one state out of 50. That's a high percentage. Mm-hmm. That's vast majority.
And let's see here. So it wasn't until February 21st that Italy reported their first death, and it's gotten to the point now. So that it was February. That was a month ago. Yeah. So their first death was a month ago. Yesterday there was over 700 people that died
in one day.
Yeah. So that's why the U.S. has kind of taken these drastic measures, at least what some people think are drastic measures, to kind of limit the amount of contact to spread all this.
Right.
Because we don't want that to happen.
No. If we have that level of loss of life in this country, Americans don't handle that shit, because we've never had to handle that shit before.
No.
We'll go fucking nuts.
There was a infectious disease or infectious control, whoever it is, in the UK that was doing modeling a month back or so. Mm. And what they were saying was, if the U.S. didn't take drastic measures on the high end, they said their model showed about 2.2 million deaths in the United States. Mm. And this is I will admit that as of a month and a half ago, I wasn't, very concerned about this.
Right.
And it wasn't until we started really seeing it in the hospital that was like, well, obviously something really serious is going on.
Right.
And when you started seeing the death toll in places like Italy, now granted, you can look at those numbers and you can say, well, Italy does have a much older population on average than the U.S. does. It's got by far the oldest in all of Europe. Mm-hmm. So if you're looking at the numbers, you can say, well, yeah, this is something that obviously has a higher mortality rate for older citizens. So it makes sense that Italy would have a higher death rates.
But still, 700 people in one day, that's a lot from one illness.
Oh, yeah. Well, you figure the flu, on average, over the course of the past 10 years, you're about 40,000 deaths a year attributed to the flu.
This will surpass that.
If
this year.
I don't know, because
worldwide.
Oh, world, no.
The 20,000, the 40,000.
The 40,000 just in the U.S.
Oh, it won't surpass that.
I don't think it will. Because
at least I hope it doesn't.
Because I think we've taken appropriate measures as of right now, at least. Right. And the more than likely what's going to end up happening is there's going to be waves of this. Mm-hmm. Because hopefully when the weather gets warmer, it'll affect the virus.
Theoretically.
If it works like other known viruses. Mm-hmm. And we'll actually see a drop in the numbers. But hopefully what could happen is once those numbers start dropping, people will go back to life as normal.
And it'll start all over
again. And I'll start all over again.
Right.
And that's where I think you could theoretically get up into that $30,000 to 40,000 person mark.
What do you think the likelihood of them getting a vaccine out in the next 10 months?
Generally, it's about a year.
Mm-hmm. Or more because of testing.
And all that. I have read some studies that said that they're already working on some things, but I
read one article that said they had tested a vaccine on a human already. Mm-hmm. But they didn't have any results of that article, and I haven't seen it.
It could take a while before we get anything out of that.
Because I think a vaccine is the number one way to prevent this.
Absolutely.
It is
and actually, what would be a faster way is if they could find already manufactured pharmaceuticals that can work to stop the spread of it also. Right. Because then you don't have to worry about testing and all this other stuff.
Right, because they're already established.
Yeah.
So there was the rumors about that malaria drug, but that's primarily a drug for fevers, and I think it's one of those things where it may be helping with the symptoms of corona, but it's not actually doing anything. Yeah,
they need something that prevents it from getting into the lungs is the big issue. And I will say that if you do start feeling symptoms if you start having a fever or anything like that, stay away from ibuprofen. Only take Tylenol, because ibuprofen actually makes the situation worse.
Does it?
Yeah.
Well, for me personally, I take ibuprofen for pain, and I take Tylenol for fevers. I always have. Yeah. Because Tylenol is the only thing that really works on fevers for me. So that's just me personally. So I guess I'll be all right.
Yeah. So if we go from like the middle of February to, if we jump all the way to like March 3rd, this is where March 3rd is where it kind of really took off in Italy. They reported an additional 466 new cases over the day before, and South Korea was at that point at 600 plus each day. Mm-hmm. So it was really kind of growing, and I still don't think at that time Italy had really done anything to really self-isolate or really block off parts of the country. Mm-hmm. And I think that's why you saw, because the federal government wasn't doing anything much of it here, I think that's why you saw states kind of taking the drastic measures that they have as far as like closing everything down. I will say that I was listening to an interview earlier today, and it wasn't a podcast related to the virus. It was actually a music podcast, and the musician that they were talking about started going on about, well, because he lived in California. Mm-hmm. He's like, well, the governor here is doing this and doing that, and he doesn't give a shit about the businesses here. All he cares about is trying to stop this or stop that, and he's not thinking of the economic impact.
Where's the economic impact of a bunch of dead people?
That's kind of where I was going. I understand that businesses, this is going to hurt businesses. It's going to hurt the economy, but the big thing is, if you have 2 million people die, that's going to be an even bigger impact on your country.
Yeah, that's, I mean,
at 2.2 million, that's about 40 to 50,000 deaths per state.
Yeah, I'd say that's about right.
Right, if my math is halfway decent off the top of my head.
Yeah, it sounds about right. Yeah.
That's a big number.
It is. per state. Absolutely. Well, I mean, and to put it into perspective, obviously, the planet's population is a lot heavier now. But what was the death toll of the plague in the 1600s? It was like 35% of the population. 200
million,
right? So
roughly, by estimate.
I would say, based on what the population is, 2 million isn't a lot now. I mean, relatively speaking, to almost 8 billion.
It's funny you mentioned that. I actually have that up on my computer somewhere.
But as far as modern times, we've never seen anything like this.
No, absolutely
not even the flu outbreak in the early 20th century.
The Spanish flu killed between 40 and 50 million.
Did it really?
Yeah.
Okay, see, that's a higher number than I thought it was.
And that's the funny thing is I saw something in the beginning of the year before all this like really took off. I saw, I think it was a meme. It was like, oh, every 100 years we have a pandemic. And it's like, well, in 1920 we had the Spanish flu, and what's it going to be this year? And the Spanish flu ended in 1919, but I understand where people are trying to make the stretch.
Right. Well,
I want to say it was like November or December 1919 when it was.
As a species, are pattern-seeking animals.
I know.
So that's just normal.
And the reason I remember that because I think it canceled the 1919 NHL season.
Oh.
And one of their bigger stars died.
Oh, right.
of the flu. So you mentioned the
Black Death,
the Black Plague, the bubonic plague. It killed 200 million people.
Wow.
Between 1347 and 1351. So in a 4-year span, it killed 200 million.
Yeah. And what was the population of the planet at that time?
Oh, I have no clue.
It was
nowhere close to the billions that it is now.
I remember.
Was it now 7 billion or something like that?
It's almost close. It's just approaching 8.
Yeah.
That was like 30% of the world's population. I remember there being something about it being a huge percentage of the actual planet's population. Mm-hmm. I mean, we're talking close to extinction level issues.
And surprisingly enough, the swine flu in 2009, 2010 killed 200,000 worldwide.
Worldwide?
Which I didn't realize the number was that big.
Now that 2.2 million, is that worldwide or just in the U.S.?
That was just in the U.S. is what their model was. 2.2 million in the
Because
U.S.
worldwide it would be a much higher number.
Yeah, I'm going to see
what the models show for.
Talk amongst yourselves, Ian.
Oh, shit! I didn't bring my other voices.
The current death toll worldwide is exactly 13,000.
Okay, right now.
But
what were the models based on that 2.2 million?
I don't know. It was only in reference to what the U.S. was doing at that time, so that's all it talked about.
Right. Well, I think we've already gone above and beyond on some things to prevent that number from occurring. Mm-hmm. So that 2.2 million isn't going to happen.
No. But
and right now, the current deaths in the United States is still what? It's under 100, right?
Talk amongst yourselves again, Ian.
So, Ian, how about that local sports team?
In the U.S., it's 301.
301, okay.
So we've had 26 deaths today.
Okay.
Yeah. So, and the kind of the strange thing is, like I said, back on the last Friday was what, the 13th?
Yeah.
Mm-hmm. There were 2,210 cases. Mm-hmm. Just a couple of days later, on Monday the 16th, it was up to 4,465. The next day, Tuesday, the number was at 6,135, and the number right now is just under 24,000.
Right. So it's going up exponentially.
Well, that's the interesting thing. Well, not the interesting thing. Well, kind of we knew that was going to happen because we see it. We see people that are. So if you come in, and they'll test you for flu A, they'll test you for flu B, and if you come up negative for both of those, they say, okay, we're going to send you home and self-isolate.
Right.
So they're not even testing a lot of people. Right. I know there's a county in Ohio that's already came out and said that they're not going to test people unless you're critically ill. So I don't think we'll ever quite know the true number of infected people. It could be, if it's 25,000 confirmed cases, it could be, 30 or 40,000. It could be 150,000.
Well, there's an incubation period too. So there's people walking around who feel just fine, who are carrying the illness.
Yeah, because that's kind of the big thing that kind of differentiates what's going on with this, opposed to what's going on. What typically goes on with the flu is the incubation period. Mm-hmm. Normally with the flu, you're talking 3 or 4 days before you start.
Yeah, fair
say 3 to 5 days.
Mm-hmm.
Before
7 on the high end, maybe.
Before you start feeling, I think it's between 3 and 5. Right in that range is kind of the
incubation period for this is up to 2 weeks.
Up to 2 weeks.
Yeah.
So you could go around. So with the flu, you're going to theoretically you could infect, or you could spread it to say 7 to 9 people,
mm-hmm.
and with
before you're sick. And
exactly.
Stay home.
With COVID, you're going to spread that to almost 50 people before you
or more
right before you know it.
Especially with large groups, which is why. I saw a video, and obviously there's risk of it being taken out of context, but it's a bunch of these,
like
early
everything.
20s saying how they don't understand. They're not the high risk. They're going to go party. They want to go party for spring break.
Oh yeah, I saw videos of the beaches in Florida.
Right. Well, this is even after that. This is more of them just bitching about it.
Yeah.
Saying they were going to do it anyway. And in areas where there's like everything's closed, like you're going to get fined if you're out and about in large crowds.
Mm-hmm.
And they said they're going to do it anyway. So just imagine what, if you're in a crowd of 1,000 people, how hard would it be for every one of those people to be infected by 5 other people,
Oh yeah, it wouldn't be hard
and
at
then
all.
those 1,000 people can go and infect 40 to 50 people then individually. That's 50,000 people right there.
Absolutely. And that's how it spreads so fast. And the thing is, even if you are young,
you can still get it.
You can still get it, and you can still die from it.
Right.
I mean, you're at no age are you immune to this.
Right.
Because there was
your mortality's better if you're younger.
Yeah.
But it doesn't negate the risk.
Exactly.
And it's, from what I hear, you're sick. You're very sick.
Absolutely. I was reading an article about a lady on the west side of the state. She was younger. I don't know how old she was, but from the picture of her, she looked like she was late 20s, early 30s. But she said she felt like she was going to die for a couple of weeks.
Right.
Then we had a patient, I won't say their age or gender or anything like that.
Info, yeah.
But I will say that they were under the age of 35 that we intubated a couple nights ago because of this.
Right. Which means they could not breathe on their own.
Correct. She was in obvious respiratory distress. Mm-hmm. So even if you're younger, obviously you have a less of a risk, but it doesn't mean that there's not a risk.
Right.
And that's kind of the thing and the other thing is, even if you're younger, let's say you're 25, 26, 27, 28, let's say between 25 and 30. You're on average, your parents are going to be what, mid 50s?
Right.
They're at a higher risk.
Right. Your grandparents.
Yep. So then that's kind of the thing you have to think of is even if you're at a lower risk, you're at a higher risk to infect the rest of your family.
Right. Well, that's I was on the phone with my dad because I haven't been over my dad's house since this kind of all blew up.
Yeah.
And
which is probably a good thing.
Right. Well, and I told
him, especially since we were probably carrying coronavirus.
Well, and I told him, I said, based on my schedule, the next time I could probably just come over would be 2 weeks from now. And I said, but I'm going to play it by ear because if there's, I could be carrying this, and
absolutely,
I don't want to bring it to you, even if I don't show any symptoms. I could still be carrying this.
Yeah, because I've been kind of doing the same thing. I mean, my youngest has had respiratory issues before, so obviously he's probably at a higher risk than you normally would be, even though he hasn't had any issues for the last 8 years. But I've been kind of trying to stay away from everyone also. I stayed on my office down here and play video games and play on my computer. But
so it's business as usual.
Something like that.
Right.
But, I'm doing it to kind of not completely isolate myself, but try to stay away
right
a little more to be more conscious of what's going on. And I've been really vigilant about washing my hands and all that stuff. But in the environment in which we work,
we don't know.
You could do everything under the sun and still get it.
Our position is not as risky as nurses and techs and doctors who are actually like up close and personal
hands on with them, which we are to a certain extent
to a degree,
also.
but we're still at the back end.
Yeah.
Of that. So, but that doesn't negate the risk.
No,
because we're still in a risky situation. So
yeah, absolutely. And so if you look at the death rate, the death rate like worldwide is kind of skewed because it's higher in China.
Right.
The death rate in China was between 3% and 6%, but outside of China is about 1.5% to 2%.
But Italy is way higher than that.
It is. Right. It is. So if you look outside of China and Italy,
right,
it's about 1.5% to 2%. Because it's I don't know. I could look. I've got it all on my phone. I'm not going to pull up the numbers, but
I don't have any voices in my head to keep having conversations while you look shit up.
But even on the low end, if it's 1%, if the death rate's 1%, that's still 10 times higher than the flu.
Right.
So if you want to take, if they say between depending on the actions of the government and the people and cities and everything else, states, depending on the action they take, you're talking between 10% and 33%, a third of the country could get this.
Mm-hmm.
So if you take let's say take 10% because that's a nice round number. So we'll say 33 million people.
Yeah, 35 million.
35 million.
Yeah.
So and if 1% or 1.5% of those people die, you're talking almost
30,000 people, right?
No, more than that.
1% of 3 million?
I said at 1.5.
Oh, still, so 40,000. 1% of 3 million is about 30%.
Yeah.
So
I mean, it's
1.5 would be 45%.
So I mean, it's
45,000. I mean,
and that's on the low end of the low end.
Right.
So there's obviously reasons why we're taking these steps.
Right.
But if the infection rate is higher and the death rate is higher, you're talking, you start reaching those astronomical numbers that could reach.
Mm-hmm. Well, I think if it goes anywhere above 1%, we're in trouble. I mean, it just as a, you
mean death rate?
That's yeah.
But once again, that's kind of why they're taking the steps that they take. Right. Because the worst case scenario is flooding the hospitals.
Right.
Because that's the case. That's
what's happening in Italy.
That's what's happening in Italy, where they don't have enough ventilators, and they're literally picking and choosing who lives and who dies.
Well, and they can't keep it contained because they've got, they don't have enough rooms or beds for these people.
No.
And they're basically lined up in hallways.
Yes, they're everywhere.
Which under normal circumstances in a critical situation is fine, but when you're dealing with, contagious diseases, that's just, you're just breeding that disease in that area. No one's getting better.
Your math was off. It was about 500,000 people.
That's 1% of 3 million?
35 million.
Oh, I thought you said 3 million.
No.
Oh, I was going by one.
No. Because there's about there's about 300. Right.
You're right. I was, for some reason I was dropping it down to 3 million and thinking
because there's 350 million people in the U.S.
give or take. Yeah.
So yeah,
you're right. It was more. I was doing one.
I was right with the whole time. The last couple of minutes, I'm doing the math. I'm trying to do the math in my head. That's not right.
My math was right. The numbers I was using was wrong.
Yeah.
So
it's about 330,000.
Yeah.
No, 330 million people in the U.S.
Right. So 30. Yeah.
So if 10% of those people get sick, you're talking about
35 million.
Yeah.
So, yeah, and I was thinking 3 million. So
yeah,
I think I was taking the 35 and doing 10% of that.
Yeah, that's all right. So, and the funny thing is, like, I shouldn't say funny. I need to stop saying that because none of it's fucking funny. But the interesting thing is, I'm seeing healthcare professionals. Granted, they're not doctors or NPs or PAs, nurses. They're people that work in the medical field that even as of yesterday are still downplaying the risk of this pandemic.
Right.
And that's kind of the thing that it's going to be hard to get away from because of social media. Everyone thinks their voice matters. Mm-hmm. And in situations like this, we don't need that. We don't need the confusion, because I've had conversations with people that should know better that obviously don't.
Well, and I think that's a huge problem, what you're talking about, the downplaying of it, the people who are, not making a joke of it, because we have to laugh. I mean, that's the only way we can get through this kind of thing. But the people who are downplaying it in the sense that it's not as severe, not serious as it is. But there is another side of the spectrum where people are taking it too far. Not as big, nowhere near as big.
I would say the bigger issue is people that are downplaying it rather than the people that are panicking.
Oh yeah, there's not a problem with the people, because that's not, in a situation like this, I guess, and ultimately you can't really be over prepared.
No, because that's
so if you're freaking out to the extent, I mean, short of causing riots and stuff like that, I mean, that's a possibility, but it's not happening. But it is, you're going to see it on both spectrums with social media, no matter what.
Yeah, because people make a big deal of, I went to the grocery store and there hasn't been toilet paper in 2 weeks.
Right.
Which I understand. is obviously something we shouldn't be doing.
Right.
Is hoarding,
right?
Because that can feed into more of a panic.
Oh yeah, well it has. I think it has.
I understand why people are preparing, because obviously
there's a difference between preparing and, like you said, hoarding. Which
yes.
There is a lot of hoarding going on.
Yes, there is.
Which is why they've had to institute, no limits to 2 of things, specifically toilet paper. Which today my mom went to the grocery store and they were told in line, because she had to get in line in the morning before it opened up. There's toilet paper, but it's 2 per person. That's it.
Yeah.
And she was like the 25th or 26th person in line. And when she got in there wasn't that much left.
Yeah.
It was already pretty much grabbed. So that's why you have to do that, because of those situations.
Yeah. Back to, so I guess not back to, but it's interesting though, because you see that there are shortages, and there have been shortages for a period of time now. Mm-hmm. I would think for the most part, though, everyone will be restocked at this point. Is there no one producing any of this stuff? It's the same thing with, like, there's a huge shortage of N95 masks. Right. First off, the hospital that we work at, I don't know how we're not, floating in these damn things. Every hospital should relatively be prepared for something like this.
Well, I read something the other day that said that and I think it was nationwide, about the N95 masks, that there's before this there was a stockpile of about, I want to say it was like 50 million masks or something like that. It might have been closer to 100, but it was under 100. But with this, what's going on, they were saying that number should have been closer to 1 billion.
Oh yeah, absolutely. But but the thing is, I understand you couldn't really foresee something like this happening.
No, but
you've had since November,
right? Well, and I mean, there's been talk about global plagues before, because of the ease of travel in the world that we live in, just modern day travel.
Well, we had H1N1 a couple of years ago,
right. I mean,
that killed a bunch of people in the United States. So I mean, we've had
this, similar. We're not to this level,
scale.
But there's been people who've been analyzing the possibility of this for decades.
Oh yeah, absolutely.
So it's not. There is some elements of dropping the ball here, and you went over it. How, I mean, we've had since November to really look at this and say, maybe we should start preparing for this.
Especially when you started seeing an explosion since end of January,
right.
The last 2 months.
Right.
You've had at least 2 months that's been here in the United States. Mm-hmm. It's been over 2 months since the first case was reported,
right,
in Washington.
So they should have upped their manufacturing of those masks.
Absolutely.
And because we know stories of nurses making their own masks,
yes,
just to protect themselves.
Because and it's not just masks; it's goggles that we're short on, it's gowns that we're short on, it's disposable stethoscopes that we're short on. Because this is when you get to a severe state, not even before it gets to a critical state, it's a respiratory illness. Mm-hmm. So stethoscopes are something you need,
right,
when you diagnose the patient.
Right.
Without stethoscopes, it makes your job a lot harder.
And that stethoscope is making physical contact with a patient.
Exactly.
Yeah.
So it's the necessity items that we're short on, that a lot of people are short on, that could create a bigger issue than what it is or what it could possibly be.
Right.
It's but there's and a lot of people blame the government for
dropping the ball.
But I think the blame is wider than that. I think
because
individual hospitals have a role to play in that also. I think the government has screwed up things.
Well, and I think just Americans in general, we're very complacent. Like I said, we've never dealt with this kind of level of chaos like this. I mean, even 9/11 is coming to a point where that will be pale by comparison to what we're dealing with now.
Now, do you think if the United States government would have taken a stronger stance before the second week of March,
Oh,
do you think it would have helped?
Yeah, probably.
I mean, just a week and a half ago, roughly, the president was on TV and told the country he had everything under great control, is what he said.
Right. Yeah.
And he gave himself a 10 out of 10 on how he was handling it.
Well, and he's now calling himself a wartime president.
Is he?
Yeah, he his words. I didn't make that up. He says, well, he didn't say he was a wartime president. He says, I'm kind of like a wartime president.
But, but he's claimed in the past that this is all a hoax.
Yeah.
The Democrats,
that's what,
Democrats and the media were using it to cause millions of people not to
talk about downplaying it.
Yeah. And that's kind of what I was going at.
Right. He once he started taking the initiative and doing stuff, that's when I started to go, okay, he's starting to do the right thing. But then all of a sudden he's doing things like what you're talking about, to the point where he keeps calling it the Chinese virus,
which is stupid.
But he here's the thing: it's not just his words. There's a close up of his notepad
where it's sharpied out
and says Chinese. Now I looked at that and said that could be fake.
It could be.
But he's still doing it. He's still saying it.
I know, I'm seeing it making the rounds on social media that people are calling it that also.
Right.
Just because something it comes out of a certain area, it doesn't.
Right. Because all that's going to do is it's going to create fear and panic about a certain group of people.
Yeah.
And they're going to become pariahs.
Oh yeah, because it
happens all the time.
It happens all the time.
So.
But on there's a March 13th NPR PBS poll that asked the question, do you think the coronavirus is a real threat? 76% of Democrats said yes, 50% of independents said yes, and 40% of Republicans said yes. But and I'm trying not to make this political.
Right. But it is to some degree.
It plays a role in it because the president has politicized the response to the pandemic.
Mm-hmm. Absolutely. And the sad thing is I know a president, Hillary Clinton, wouldn't have done that to that degree. She would have done it, but she wouldn't have done it to such a degree. I know a President Biden or a President Sanders wouldn't do that. Mm-hmm. So I don't understand why it's acceptable to even just Republicans that he's doing this.
Oh no, it's strange and odd all at the same time. But when did I say the first case was in the United States? January 20th, something like that. So on January 22nd, the president, because we've been having these daily press conferences about it, the president said that we have it totally under control. It's one person coming in from China. It's going to be just fine. Mm-hmm. February 2nd, we pretty much shut it down.
Like a week.
Yeah.
Not even a week.
He said,
or just a week.
He said, we pretty much shut it down coming in from China. February 24th, the coronavirus is very much under control in the United States. Stock markets are looking good. Are looking good to me, is what he said. Because like a stock market really means that much. And that,
well, it does. My dad's lost almost $100,000 in his retirement.
I know a lot of people have. But that's the interesting thing. The response is, I'm hearing a lot of people talk about, we need to help the banks and we need to help the airlines. I think the bigger issue is we need to help people at this point.
Right, because there's a lot of people who can't even pay their fucking rent.
Exactly. So on the February 25th, the president comes out and says, CDC and my administration are doing a great job of handling coronavirus, which at that point we're seeing more and more cases. Mm-hmm. February 26th.
Excuse me.
The 15 cases in the United States within a couple of days is going to be down to close to zero. What did I say? We're at 25,000?
Mm-hmm. Thereabouts.
And 300 plus deaths less than a month later?
Right.
I mean.
Yeah, that I know.
I'm trying to find. There's a couple of them that are real.
He had a Twitter war with our governor saying she wasn't doing enough.
I know. February 27th. One day it's like a miracle. It will disappear.
Excuse me. I got the Rona. Motherfuckers got the
Rona.
You
got the Rona. Coughing around me, you sons of bitches.
I have a cough. I've always had a cough. I smoked for 30 years.
Yeah. I don't know. He's just all over the fucking place.
Right.
He compares it to the flu. He says that it's not going to be a big issue, and then all of a sudden he's,
backtracking.
Yeah. March 13th, I take no responsibility. March 9th, this blindsided the world. Did it really? It's been going on for 4 fucking months.
Right. You'd have to be blind to be blindsided by it.
March 16th, Trump gave himself a 10 out of 10 for the way his administration handled the whole thing.
And this just the other day was when he did the whole "I'm a war." I feel like I'm a wartime
I haven't
president.
seen that. That's great.
Yeah. That was. What did it say? Saturday. It was like Thursday, Wednesday or Thursday. He said that.
I guess I'll look at it this way, Ian. What are the lessons that we can be taken from this pandemic and the response to it?
There's like major lessons and then there's side lessons. The major lesson is that we live in a global community and things like this are bound to happen. So maybe we should start taking better care of ourselves, washing our fucking hands.
I think it will fundamentally change our society, actually.
I have a feeling it will. I would say the handshake is dead. You know, a symbol of friendship, of partnership, of understanding that has existed for centuries, maybe longer, is gone in 2 months, 3 months. It's disappeared, and will probably never come back. I know that's not exactly what you're talking about in terms of changing our society, but it's even little things. It's little things like that you know that we've always taken for granted. But
I think under a certain level or there's a certain amount of our society that I think will always be hoarders to a certain point. Yeah. Depending on how long this goes on, I think we may be a society that may become more self-reliant.
Maybe
a little bit more trusting of science.
Well, that would be my biggest hope. My biggest hope, but that's where I was going to go.
And I guess it really depends on the level that it reaches and the amount of deaths, also. Right.
Well, and I was going to say when something like this goes on, people are relying on organizations like the CDC and health professionals to tell them what to do to either keep themselves safe or to make themselves better. And maybe people who have, over the last decade, rejected the scientific evidence of vaccinations in preventing illnesses of this magnitude might...
Even though there's no vaccination that would
have prevented this. No, but it just in general. I mean, smallpox and all that other stuff. Well, those things were eliminated because of science, because of scientific and medical breakthroughs.
There's a big section of yearly deaths from the flu that could be prevented with simply having a flu vaccine.
That's my point. People who refuse to get vaccinations might wake up and say, "Oh, maybe it's worth it."
Yeah,
you know,
maybe
because they become. I mean, not in this situation, but in the next one, the unvaccinated could be the ones who spread the disease, who are the most vulnerable. Mm-hmm. You never know.
And there's always a portion of, I don't want to blame everyone that's not.
Well, no, because there's a lot of people who are not vaccinated for other reasons other than
there's
their choice.
There's a lot of people that, because of their immune system, can't be vaccinated.
Or they're too young or too old or whatever, yeah. I get it.
I also hope
I'm talking about the people who choose not to get vaccinated.
Anti-vaxxers.
Yes.
Which I'll never have a high opinion of. You can bash anti-vaxxers all you want. You're not going to bother me.
Yeah,
but
I wouldn't care if I did.
I hope that we get to a point also where we trust social media less.
Yeah, I don't know if we're there. I don't think this is going to change that.
If a couple million people die in the United States, I think
it'll be forgotten. All this shit that Trump's done and said it's already forgotten.
We'll see. Because it's not just
Trump. Hasn't affected his numbers.
The most inconsistent things I've read are from websites that are
linked to
that
Facebook.
I've never fucking heard of before.
Right, and linked to Facebook.
You know, I would say if you're going to read something and you're going to trust something, make sure it's from an official source.
Right.
Or it's citing an official source. It's citing the CDC.
Honestly, I don't think that's going to change, and it might even get a little worse because everyone that has had to self-isolate, people who are out of work and at home, what do they have to do other than get on fucking social media?
Yeah.
It's the only way they can stay connected at this point.
But the funny thing is,
especially with social distancing, and I think it's only going to intensify that.
But the funny thing is, though, with the amount of people that are at home and spending time online, I feel like the country has come together more in spite of what happens in Washington.
To some degree. I mean, there's a lot of consensus. I mean, we all know that there's an issue here, and we all know that we need a solution, and we need to get a solution as fast as possible. So it's our common interest that's bringing us together. But once that's gone, I don't know.
It's funny if you look at.
I'm hoping you're right. Believe me, I would like you to be right on this. I just don't. I don't think it's as.
Look at the campaign of Andrew Yang, who for a year was talking about a guaranteed income to everyone in the country, $1,000, and he was basically ignored by
everybody,
most people, and then almost laughed off the stage by the rest of them. It was like, oh yeah, whatever. It's completely nonsense. It's never going to work. And then something happens, and then now we're looking at
potentially having to do it, but not long term though.
Not long term, no. True. But you have wide consensus,
and you
across
can argue
the country.
that the same thing with Bernie, and Bernie mainly because he's pushed this consistently for his entire career. Universal health care, when there's a lot of people who don't have the health insurance to even be seen by their own doctor. They don't have a doctor. Our policy is to try and get people to go to their primary care physicians rather than come to the emergency department. And these are people who don't have PCPs. They don't have primary care physicians because they don't have insurance.
Well, first off, if you feel sick, you shouldn't go to your PCP.
Stay home.
You shouldn't go to the emergency department.
Right.
You should stay home.
But I'm talking about even these people who might get critical.
Yes.
Mainly because they may not be in the best of health to begin with because they can't afford, high quality foods or, they have to eat junk. Because let's face it, the poor can only eat bad food.
Because it's cheap.
Yeah,
absolutely.
And healthier food.
And they also get, they don't get the sleep that they should get.
Exactly.
Because, they're working multiple jobs and life is obviously more stressful. And so there's a lot of contributing factors to the poor.
Exactly. And Bernie's, been pushing for a lot of social programs that would have eliminated that.
But I just think it's funny the complete turnaround on an idea that, like I said, Andrew Yang kind of ran on for over a year.
Right.
And now it has wide sweeping acceptance across the country if you're Republican, Democrat, Independent, whatever, Green Party, there's wide consensus.
That the government should be sending out some checks.
Yes. And it's
just to alleviate as a stimulus.
Absolutely. So it's like you see things change. And I hope, like I said, I hope that there's long-term change. And not as soon as this thing is gone, we go back to being a bunch of grumpy old men yelling at the kids cutting through your yard.
Well, that's me already anyway. But at least
you've always been a grumpy old man.
Well, I guess to some degree I have been.
But I can see people, 40, 50 years from now still, if you go in their storage closet, they'll have packs of toilet paper.
Right. Grandma, why do you have so much toilet paper? Oh, the plague of 2020, man. I'll never forget it.
I don't know. I don't have a whole lot more to add.
Well, I was just going to bring up, and this is more of a side note, I guess. What do you think, based on Trump's behavior thus far, because we did bring politics into this?
Well, I didn't bring politics in. It's just a side note.
But this is definitely a side note. This is a speculative question.
Oh, I love your speculative questions.
Yes.
Not really, but.
What do you think the likelihood, if this, this is going to keep going on. We've already had some, Ohio closed their polls for primary voting.
Uh-huh.
What do you think the likelihood is that Trump could use this to postpone or cancel the election in November?
That's a good question because he cannot.
If he did, even if he declared martial law.
Trump cannot do anything to the election. If something were to happen, it would, the election date is set by Congress.
Okay.
So you would need bipartisan support to postpone the election.
Which wouldn't happen.
And if it were to happen, Trump cannot serve past his 4 years unless he's reelected. It's in the 20th Amendment, I believe. Okay. So
regardless, if there were no election, he would still have to step down.
He would still have to step down, and it would go in order of succession. So depending on how I don't know if because Trump or Pence wouldn't be able to serve.
So then it would be the speaker.
But I don't know if it would be a speaker because it depends on, because it would be a new Congress. I don't know if the Congress would carry over. So it could be the Speaker of the House. It could be a number of different other people. It could be a Trump appointee, a cabinet member. There's a lot of up in the air kind of questions on how it would work. But first off, guaranteed, Trump cannot postpone the election, and Trump cannot stay in office.
But I thought say he did declare martial law, the law, he
still would not be able to stay in office.
How many people know that, though? I mean, even people who serve. I mean, it seems. I get the impression that a lot of our own elected officials have a very limited understanding of the Constitution that they swore to protect.
Well, I mean, I can't help people there. I just if you don't believe me,
no, I believe you. I believe you.
Look in the Constitution.
My point is
in the
that,
Constitution.
Trump has pointed out that not in so many ways, but he's proven that he is above the law.
And I would also say, I believe a couple of weeks ago there was a Los Angeles Times article about this also. That you can go back and read, look up.
I'll look it up. Yeah. I was just curious. I figured I'd throw that out there because
we've talked about that before. We talked about that in, obviously we didn't have a podcast then. We talked about it in 2000, was it 2008? About Bush postponing the election. And
well, I always speculated that if he really see, I mean, because we were talking about our 9/11 conspiracies. If Bush was really behind all that stuff, it would have made sense for there to be another attack prior to an election, because then theoretically he could, under wartime laws. That was my concern.
I'm almost 100% sure it was the 20th Amendment. You can go back and double check and look. I'll look after the show, but I'm pretty sure it's what it was.
Okay. Like I said, it was just something that crossed my mind, and I figured I'd throw it out there.
Right.
So
I just see potentially we had like huge monumental changes in the history of in the last 100 years. World War I, World War II, the Vietnam War, things that like changed society. 9/11. And I wonder if this pandemic is something else.
I think we'll see changes on the scale of 9/11.
Yeah,
I really do.
I guess it all depends on how,
not World War II level changes, but 9/11.
I think it really all depends on how it kind of shakes out. Because here's the thing: if what the governor of Michigan did, what the government has done to kind of try to flatten the curve, actually works, and not a lot of people end up dying from it, it's going to be, you overreacted. It wasn't that bad. Or
a lot of people die.
Or a lot of fucking people die. And well, why didn't you take action sooner? And
right.
And I think that's, if it's the first way and not a lot of people die, there might not be a whole lot of change to our society, but we'll see.
Yeah. Well, I would much rather that, because I don't like the idea of a lot of people having to die to get changed.
Absolutely not. But they understand, and they have admitted that they expect a lot of people to get this. But what they're hoping is a lot of people get this over a longer period of time. So we're actually able to treat you in the hospitals.
Right.
Because the problem is, if everyone gets it all at once,
then
we're fucked.
We're fucked. Yeah. We're Italy.
At least the hospital that we're at wouldn't be in that bad of a situation.
But it would be, because eventually all the other hospitals would be over capacity. And then we would get the overflow.
They would get the overflow.
And then once we're capacity, then there's nowhere for anywhere to go.
I was talking to somebody in the hospital that should know, and they said roughly we had like 400 to 450 ventilators. So we'd be okay for a little bit of time. But it wouldn't take long for us to, obviously, like you said, get overridden with people from other areas. And it just, once we get to the point where we're at that point, then you can't treat people. You don't have the capability of treating people.
And then you just got people dying in the hallways.
Then we turn into Italy.
Right.
No. It's just like, if you're having a conversation with somebody and they're comparing it to the flu or something like that, it's just, they're just wrong. And unfortunately, there's a lot of people there's people even listening to us that will probably think we're full of shit and we don't know what the hell we're talking about. But I would say, to a certain level, I would agree with them because we're neither one of us are doctors. We're not experts in it, but
we're not scientists.
I can only speak off of what I see and what I've experienced clinically. So,
and what we've been able to glean from reputable news sources.
Oh, absolutely. I was talking to one of our doctors last week, and he had a friend that's an attending in Washington State. And it kind of all started out west. And they said that at this point, they were a week and a half behind us. And they were still at that point intubating, 5, 6, 7 people a night, which isn't a huge number, but it's a big enough number that if it happens for a long period of time, we're going to be out of ventilators.
Right. And some hospitals already have run out of ventilators.
Yes.
Because I saw that on the news the other day.
But I don't know. It's going to be a long run. It's gonna take a while for this to get through. And like I said, hopefully it dies down in the summertime and doesn't come back.
Right.
Or it dies down in the summertime long enough that we're able to get some kind of vaccine or some kind of treatment that really works on it. Because if that happens, then maybe next year when this comes back around again, which it probably will.
There's no probably about it. It will.
Yeah.
Especially if we don't have a vaccine. If we have a vaccine, we can curb it. We can make it like the flu.
That's kind of where I was going to.
It'll be more like the flu as far as numbers go, and contagiousness. But
well, I mean,
if we don't have a vaccine, this is just going to be cyclical. It's going to keep going.
Yes.
And we're going to have,
and that's where they said it could be 12 to 18 months if it comes in waves.
Right.
If we have these peaks and valleys over the course of the next year, it could be bad.
Yeah.
It definitely has the potential to be far beyond what anything we have experienced in our lifetimes.
Oh no, I think it already is approaching that. I mean, never in my lifetime have businesses been closed down the way they are.
No.
Never in my lifetime have I heard states closing down. Pennsylvania is closed.
Yeah, I had to go to the Secretary of State early in the week, like Monday, I think I went.
I have to go too.
And you've got to have I had to have an appointment. It was by appointment only.
And how do you make the appointment online?
Online.
Okay.
And then the one I went to, walked up and there was a guy with
a clipboard.
Yeah, basically like sees that you're on there and lets you one person in at a time inside.
Wow.
So yeah, I mean it's definitely
it's new for all of us.
I drive down.
I don't even this isn't even something our grandparents would have experienced. Not like this.
Yeah, I don't know what the reaction was.
I mean, none of my
the Spanish flu.
My oldest grandfather was born in 21. So this would have been past the Spanish flu, and all my other grandparents were 25 and 26.
Okay, so my grandfather was born in 1900. So
okay, but he's not with us anymore.
No, he died in the early 60s.
Right.
So it's I don't know. Hopefully this kind of dies down over the course of the next month and a half, and we have some kind of medical breakthrough and we're able to get a vaccine for it, and it's just another blip on the radar.
Like you said, maybe find something that we already have established that might help to not necessarily prevent, but alleviate, reduce the issue. Maybe shorten the time of illness. It's one thing if we're overwhelmed with people coming in, but if we can get them out faster, that would help a lot.
The big thing is stay home.
Wash your hands.
Wash your fucking hands.
Sanitize in between.
Yeah. Whenever you lately because
bathe regularly too. That's a big thing too.
Obviously, I can't just stay home because I've got
I work. We work in an industry that doesn't close.
And so when I've been trying to, whenever I'm out anywhere, I always carry hand sanitizer with me. I try to sanitize my hands as much as I can when I'm out in public. You have to assume that everyone has it and that everything is dirty.
Yeah.
That's kind of the way you have to kind of look at everything right now.
Yeah.
And
and that's probably accurate to some degree.
Yeah.
At least everything's dirty. Mm-hmm. I bought a scratch off and I won $50 on it.
Yeah.
And I got it in cash, and I got the cash and I put it in my pocket, and I was like, because I don't carry cash. This is the first time in months and months I've had cash. I'm like, Oh shit!
I got the Rona.
The Rona's in my pocket. Because I mean, like I said, it was funny because it didn't dawn on me until literally, maybe a minute later, I was walking out of the store.
Yeah.
I'm like, oh shit. Brandon. Now I hand my debit card over to people.
Yeah.
All the time. But
Really?
I don't even think about it.
Most places,
but they're like I go through a drive-through, you hand your card, your debit card or whatever.
I went to the drive-through today and lady had a glove on.
Yeah, well, and I've seen that even before all this, but usually flu season that starts to happen, but still, I didn't even think anything of it. But they got that money, and I was like, oh my god, I was actually kind of panicked by it.
There is one other thing I did want to say though,
okay,
and that is, don't think so. If you're immunocompromised, wear a mask when you go out in public. Mm-hmm. I don't want, and what I fear could happen is healthy people put on a mask and think just because they have a mask on, they don't have to wash their hands.
Right.
Or they're safe. And that's not the case. The best way is always going to be wash your hands.
Right. Which,
don't touch your face.
And don't if you can avoid it.
Don't be a slob.
Yeah, exactly. Just bathe, wash your hands, sanitize.
I can't tell you how many times I've been in a bathroom and I've seen
grown men.
Yeah. I would say a vast majority of them don't wash their hands.
And it's funny. When I go to the bathroom, in a public restroom especially.
Here I'm rubbing my eye too.
Right, I know. I have allergies. My face is always itching.
Yeah.
When I wash my hands in public restrooms specifically, not because I'm touching myself while I'm peeing or whatever.
You're making me have to clean my hands. Right?
Yeah. I'm doing it because I had to touch the fucking door coming in.
Oh yeah.
And it's just the very idea of being in that room.
That's how I always feel. Yeah, when I'm in a public bathroom, it's like
I'm not washing myself off. I'm washing them off.
There's feces everywhere.
Exactly. Yeah.
So now you have to just imagine the whole entire world is
and I'm not even worried. And it's feces. It's just dirty people touching themselves and then touching other things. It's like, oh. Yeah, feces and dirty penises everywhere.
Oh Jesus!
It's just
wait, hold on. So you'd be fine with clean penises everywhere?
No, because they don't exist outside. You know what I mean? It's like there's for every 10 clean people, there's at least 2 that are out every 10.
I would say
it's probably even higher than that, but still, even if it's just 2. There's still 2 dirty penises for every 10 people that go in there.
A vast majority of the people I see in a public restroom will only stop to wash their hands if they see that you notice them. If they think they can just scoot out, they're gone. They don't stop to wash their hands.
Not me. I never have, even as a kid.
Especially working in the hospital. I mean, it's disgusting.
And that should be the one place where you should be washing your hands all the time.
All the time. Yes, exactly. I don't have anything else to add, Ian. Is there?
No.
Wash your hands. Don't touch your face as I'm touching my face.
Right. I honestly, you can't avoid touching your face, but don't touch your face unless you've just literally sanitized your hands.
Which I literally
that's what I do.
Did.
Honestly, that's what I do at work. When I'm at work, when I feel an itch coming on, I put the sanitizer on, and then I even wet. I don't even care.
That's the other thing I would say
with the wet hands.
Is hospitals are running out of hand sanitizer now also.
Yeah.
Which that could be an even bigger issue. But we'll
Potentially.
See. Potentially.
Because there's some debate as to how effective that is too. I don't know.
It's effective against it.
Yeah.
Yeah, absolutely.
Yeah.
But you gotta make sure you actually clean your hands with it.
Right.
If you just put a little dab on there and
no,
then no, it's not helping you.
No, it's not.
I'll just kind of leave it there though. It's I don't have anything else to add. Any questions or comments? You can email us at contact@lifeandjournalpodcast.com. Check us on Twitter at LIGpod, which Ian never knows, so I was going to ask him, but it'd be like 45 seconds of dead air. Check us out on
Good call, sir. Good call.
Check us out on Facebook and Podbean, Apple Podcast, YouTube, Spotify. Did I miss anyone else? Pretty much everywhere.
Yeah. No, I don't think you missed anybody.
I hope that we've been somewhat informative. I will say that if you have questions, I can try to answer them. You can email me at nick@lifeandjournalpodcast.com.
You just can't give medical advice.
I just can't give medical advice, but I can try to steer you in better directions.
Yep.
So,
absolutely.
That's it. Until next time.
Talk to y'all later.
Peace.
Playing my role, let me tell you about it. This shit right here, man, I'm about it. Only real niggas reside around me. Yo, old lady, drop a crowd around me. Dip like I know you can, bitch. Show me the ropes like we in the ring. Got you two cobras, you wanna hang. Shoulder to shoulder, the niggas basic. You know I won't lie. You know that I ain't for that fuck shit. You niggas alright, but I'm way better and she love it. Know that y'all sick as fuck. Here go this tissue, bro. We taking the dub, hoping you get you some. This hit like a pick me up. She taking my drugs. Know they see the sign. That's some dollar signs. Know they sick as fuck. Know they sick as fuck. Tell them get well soon. Tell them get well soon. Know you sick as fuck. Get well soon.
Oh shit. Watch out, you the god, Billy. Oh shit. Right now, and I'm smiling in your face, bitch. With a gold smile, you should probably make placement. To your eye, niggas sick as fuck. Standing with niggas who down for that party. Who down for some bitches who showing their bodies. Swear to God, nigga, this Molly got me up and rolling. These bodies of water. Bring that shit in bottles. We mash at the party, that hit when we style it.